Hello everyone, I'm Dr. Akshita, Senior Resident in Department of Psychiatry, JSS Medical College and Hospital, Mysore. You might have heard many people saying, I have OCD. I'm so obsessed about this. So, do they really have OCD? Or is it how OCD looks like? The general notion about OCD among people is that if somebody is very particular about timing, orderliness, cleaning, or the way they wish to have things, have OCD. It is not so. So let us know what OCD actually is. OCD is a common psychiatric condition. Why do I say it is common? Because it is seen in nearly 1 to 3% of general population. It is seen in both men and women. Also, it is seen among children. The usual onset of disorder is during adolescence, also during young adulthood. That is 16 to 25 years of age. How do they present? The person with OCD will have either obsessions or compulsions or both. What are obsessions? These are unwanted, intrusive, repetitive thoughts, images or urges which are distressing, anxiety-provoking and time-consuming. For example, person with OCD may have thoughts that his hands are being contaminated. For example, whenever he is at house or somewhere, he gets thoughts that his hands are being contaminated. That leads to anxiety. He thinks that he is probably inviting danger. He may get infection. So that induces anxiety or some amount of distress. What he does? So he tries to wash his hands. So he washes his hands, it will relieve distress or anxiety. So this won't stop here. He'll get similar thoughts, that is again provoking anxiety and distressing, followed by washing. It becomes vicious cycle. This is how obsessions and compulsions present. The common obsessions and compulsions we see in OCD patients are repeatedly washing, that is preceded by contamination thoughts, or repeatedly checking locks or stove, preceded by having thoughts regarding safety, whether door is locked or not, or whether stove is turned off or not. Also sometimes it can be related to sexual content, aggressive thoughts, repeatedly getting thoughts of harming others, like this. Compulsions need not be always visible to others. Some people will try to neutralize the effects or the anxiety related to obsessions through mental compulsions. For example, if they get certain thoughts about scolding God, they may try to neutralize those thoughts by saying sorry inside their mind. So it is mental compulsion. This is how obsessions and compulsions present. One more thing we should know is that among women who have, for women, pregnancy and postpartum period can increase the risk for development of OCD and also can worsen the course. We know this how OCD presents. What causes OCD? It is multifactorial. There is some genetic contribution, also some stressful life events can precipitate development of OCD. The CSTC circuit, corticostriatothalamic circuit, is believed to be involved in causation of OCD. Usually this is chronic disorder with the waxing and waning course. If they present early and seek treatment, the prognosis is always better. So how do we manage this OCD? We have medications, we have psychotherapies, we also have neuromodulation techniques. SSRIs, that is selective serotonin reuptake inhibitors like sertraline, fluoxetine, fluoxamine, are commonly used as first-line drugs. The dosage required for OCD is usually more than that for depression. And clomipramine, atypical antipsychotics are also used in treatment of OCD as second-line drugs. Apart from these, cognitive behavioral therapy, exposure and response prevention are some of the commonly used psychotherapies which are beneficial in treating OCD. For the cases who are resistant to medications or therapies, can be taken up for neuromodulation techniques like transcranial magnetic stimulation and also deep brain stimulation. This is about OCD. One more thing is that many patients present to psychiatrists or seek treatment very late. They go through the suffering for many years, later they present to us. Probably because they will not have awareness that it is something it is some psychiatric disorder, or there is some treatment for this. So if we spread the awareness among general population, also among other medical professionals, it becomes easy to tackle and reduce the burden due to OCD.